Okay, Yvonne, I suppose one question for you is, how would you treat a fit PS01 patient with non-squamous non-small cell lung cancer? Sketch it out for me, your sort of therapeutic approach with those patients.
So for those patients, clearly the standard of care is now cisplatin pemetrexed, if they're, as you say, if they're fit enough for it. And in terms of how I go about discussing the treatment options with them, initially I'll be discussing the potential for chemotherapy, the fact that we'd be hoping to get some benefit in terms of response, improvement in symptoms. And I'd also be sketching out at that point, you know, the chances of benefit, so that we are managing expectations and just so that they're aware that not everybody does get a response. I would be planning in my mind for a fit patient like that to be thinking that providing they did well with treatment, they didn't have too much problems with toxicity and had response or stable disease with treatment, I'd then be thinking in my own mind that I would be potentially offering this patient maintenance pemetrexed on completion of their 4 cycles of cisplatin pemetrexed. But I wouldn't necessarily have that discussion up front with a patient. Some patients are obviously very well educated and will know what all the options are, and if they're sort of asking questions I will discuss it. But generally speaking, I will have a conversation initially about the initial plan for chemotherapy, what to expect from that toxicity, sketching out the plan for repeat scans, repeat x-rays, and how we'll be going during treatment. And then during treatment, often once I've seen how the first and second cycles of treatment have been going, providing they've been tolerating it and I'm getting some positive feedback that actually this treatment is going well, probably at that stage I will introduce that actually we may think at the end of treatment that we may be able to continue with a slightly lesser treatment that would be less burdensome to them in terms of side effects, but we would hope to keep their disease under control for longer if we did that. So at that stage I would probably introduce it for the majority of patients. And the reason I don't do it at the very beginning for a lot of patients is because I did, for a start, when I started using maintenance treatment, have a number of patients who were actually really disappointed, not only if they had a scan that showed that the chemotherapy hadn't worked and the cancer had progressed, but there was a double blow, and actually they then weren't going to get the maintenance treatment either. So I've probably changed what I've done over the years, and now I don't necessarily talk at the very beginning about it, but we'll do it as the treatment goes on and it's clear that actually potentially this is a patient that may benefit from maintenance
therapy. And what about if they come out with that key question on that first interview? How many cycles of treatment you're going to give? How long is it going to go on for?
So I would say to them that generally speaking we would be doing 4 cycles of chemotherapy, and that's the case for most of our patients. There'll be some patients that are on clinical trials that occasionally will go to 6 cycles of platinum doublet chemotherapy, but for our patients who are receiving standard cisplatin pemetrexed, and it's 4 cycles of chemotherapy with the aim of if they do well, they will then continue therapy.
So you sort of would bring in the maintenance context if they specifically asked you how many?
Yeah.
I mean, I do mention it quite often up front, but you know, very heavily caveat by saying, you know, 40% of patients are not going to get to that point because they don't get some benefit from it, they don't get on with the drugs, for example. So, you know, I think it's always important, but at least you're introducing it pretty early. I mean, I think the one thing not to do is
at the
sort of
very
get them in
end,
for their post-4 cycle scan and say, by the way, you're going to carry on, because in their head by that point,
that's right,
they're definitely stopping.
That's right, they think they've got a holiday booked, and they
exactly.
Although actually, you know, having a holiday booked is not an issue because we can accommodate that.
Exactly, you can be flexible around that.